fourth installment of our weekly webinar series, and we hope you find it as beneficial as the previous ones have been. My name is Chelsea Lukens, and I'm the Marketing Communications Coordinator for Itentive. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded. This will be the final webinar of 2014, but we will be starting them up again on January 6th with ICD 10. It's back! We hope to see you there at noon Eastern Time. Finally, I want to let you know that there's been a slight change-up in the presentation today, and that Cindi Kincade will be presenting on Ann McGuire's behalf because Ann was called out to a client site this morning and authored the presentation material. Ann has more than 30 years of healthcare experience, which includes physician's office management, direct patient care as a medical assistant, and corporate healthcare IT and IT consulting. Ann has worked in large healthcare systems with greater than 600 providers. Her responsibilities included implementing and educating providers and practice administrators on achieving meaningful use measures. Ann is currently working on clients' best practice workflow to help improve next-gen EHR efficiencies, quality of care, and process improvements. Cindi Kincade is Vice President of Consulting Services at Itentive and a Certified Practice Management Executive. Her experience runs wide and deep, making it possible to provide the insight needed to help healthcare organizations experience great success, no matter what the challenge is. At the end of the presentation, we will open the floor up to questions from you. We will answer all the questions at the end, but you may type them in the questions area of the webinar control panel when they occur to you. Finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box and let us know so we can resolve them. And again, questions may be entered in the questions box. Cynthia, I'm going to go ahead and pass the webinar off to you. Feel free to get started when you're ready.
Hello, everyone, and thank you for joining us. As Chelsea said, we will be talking about meaningful use audits. Are they coming, and are you ready? In fact, it's not a matter of are they coming. We all know they're coming, and it's inevitable that at one point or another, one of you or many of you will be audited. Several of our clients already have been. During this presentation, we will cover the CMS Audit Overview, maintaining documentation, documentation for non-percentage-based objectives, pre- and post-payment audits, the audit process, and then we'll give you some recommendations. First of all, let's start with an audit overview. The CMS Audit Overview, eligible professionals may be subject to an audit if they have received or are eligible to receive EHR incentive payment for either the Medicare or Medicaid program. Audits may be conducted either pre- or post-incentive payment. Documentation to support attestation data for meaningful use objectives and clinical quality measures should be retained for 6 years. Documentation to support payment calculations, such as cost report data, should also continue to follow the current documentation retention process of 6 years. Figliozzi & Company is the contracting organization performing audits on behalf of the Centers for Medicare and Medicaid Services, CMS. Individual states and their contractors will perform audits on any provider attesting to the Medicaid incentive program, and they may have their own auditing company. This could vary state by state. When a practice or organization is selected for an audit, a letter will be received from Figliozzi & Company. The letter will include the CMS and EHR incentive programs logo on the letterhead. If you receive anything else other than perhaps from an individual state, it is not a legitimate audit. Now we're going to move into just maintaining documentation. As we go through this presentation, some of this material is dry, so we're going to try to do our best to entertain you as well as to give you the very pertinent facts of this important subject. The first thing we want to talk about is the responsibility of the eligible provider to maintain documentation that supports the data submitted during the attestation. Everything you attest to, you must be able to prove, and you must have documentation to back that up. To ensure preparedness for an audit, save any electronic or paper documentation that supports your attestation. Save the documentation that supports the attestation of the clinical quality measures reported as well. The source documentation will be the primary documentation requested in all reviews. The documentation needs to provide a summary of the data entered during the attestation. The preferred documentation would be a report from the certified EHR. However, other documentation may be used if a report is not available or if the information entered is different from the report. Let's keep in mind that many of you on this webinar may be on the next-gen next-gen EHR or EPM system. And some of the reports can be generated using various methods throughout next-gen. Others may be more difficult, and in that case you do have the ability to gather the data yourself, but you must be able to demonstrate how you got it. Providers who use a source document other than a report from the certified EHR system to attest to meaningful use data should retain all the documentation that demonstrates how the data was calculated and collected. This includes the numerators and denominators for the measures, the time period the data is collected, and evidence to support the information is specific to the eligible provider reporting. This means it should have some identifying information such as the NPI, the CMS certification number, the provider name, practice name, etc. You must be able to demonstrate that you are actually attesting and the data you have applies to that specific provider. CMS suggests that providers download and or print a copy of the report used at the time of the attestation for their record. There could be additional information requested that may include the actual review of the medical records or your EHR system. We're going to start by talking about documentation for non-percentage-based objectives because many people believe that these are the easiest objectives to meet because you only answer with a yes or no. And we'll start with that. There are several meaningful use measures that require a yes attestation in order for the provider to successfully meet the objective. Not all certified EHRs track non-compliance-based measures. To validate the reporting attestation, CMS or Figliosi and Company may request additional supporting documentation. Some examples of suggested documentation. Many of you are working with the objective clinical decision support rules. There are several of these. The audit validation, they want to demonstrate that functionality is available, enabled, and active in the system for the duration of the EHR reporting period. The suggested documentation is to provide one or more screenshots from the certified EHR system that are dated during the EHR reporting period selected for attestation. Remember, there are no measures on this one. You simply have to attest yes, and then you just have to have a screenshot that indicates that you were in the data, that you utilized the template, and that you were actually trying to meet the clinical decision support rule. Protected electronic health information. The audit validation is security risk of analysis of a certified EHR technology was performed prior to the end of the reporting period. The suggested documentation is a report that documents the procedures performed during the analysis and results. The report should be dated prior to the end of the reporting period and should include evidence to support that it was generated for that provider system. An example, NPI number, CMS certification number, provider name, practice name, etc. It's important to note that the Stage 2 measure for protected electronic health information also requires providers to address encryption security of data stored in the certified EHR technology. This is probably one of the measures that is most missed when preparing for an audit. And it's very important that if you have not done this, you get this done as quickly as possible and make sure that you have the reporting available to indicate that your system does meet the criteria. And we can discuss that a little bit later in the presentation. The objective, generate lists of patients by specific conditions. One report listing patients of the provider with a specific condition. This can be any condition in your system, and you need to have a report listing the patients to show that you can demonstrate that. You can report with a specific condition that is from the certified EHR and is dated during the EHR reporting period selected for attestation. You do have permission to patient identifiable information may be masked or blurred before you submit in the case of an audit. The objective, immunization registries, data submission, reportable lab results to public health agencies, syndromic surveillance data, submission, reporting cancer registries, and reporting to specialized registries. The audit validation is ongoing submission of electronic data using a certified EHR technology for the entire EHR reporting period. The suggested documentation are dated screenshots from the EHR system that document successful submission to the registry or public health agency. This documentation should include evidence to support that it was generated for that provider system. An example again, to have an NPI identifier, CMS certification number, provider name, practice name, etc. I think you're seeing a pattern here. What they're looking for is that they want to make sure that you are using actual reports and documents generated from your system as opposed to just a generic one that may be passed around out there. They also are requesting a dated record of successful electronic transmission. An example, a screenshot from another system where you submitted it to. This should include evidence to support that it was generated for that provider, again, with the same criteria. The objective, immunization registries, data submission, reportable lab results to public health agencies, syndromic surveillance data submission, reporting cancer case registries, and reporting to specialized registries. The audit validation is ongoing submission of electronic data using certified EHR technology for the entire EHR reporting period. The suggested documentation is a letter or email from the registry or public health agency confirming receipt of submitted data, including the date of the submission and name of sending and receiving parties. For exclusions to the public health reporting objective, a letter, email, or screenshot from the registry that demonstrates the eligible provider was unable to submit and would therefore qualify under one of the provided exclusions to the objective. We have a little section here on exclusions in particular. As many of you may be looking through your objectives and different items, a lot of these items you can obtain an exclusion for, but if you submit an exclusion, you must have documentation to support each exclusion to the measure claimed by the provider. This means that you need a report from the certified EHR system that shows a zero denominator for the measure or otherwise document that the provider qualifies for the exclusion. And again, you may have questions for that, and if you have any, we can certainly talk about that at the end of the presentation. So now let's move on to the actual pre- and post-payment audits. CMS began conducting prepayment audits in 2013. Several of our clients have been audited, and I'm pleased to say at least the ones that I'm aware of have come through with flying colors. So NextGen has successfully defended audits in many, many cases. The prepayment audits are random and may target suspicious or anomalous data. Providers selected for a prepayment audit will need to present supporting documentation to validate submitted attestation data before CMS will release payment. When you're making your audits, and I'm sure many of you have already attested for these, many of you have already provided your attestation. They're looking for things that are outside of the norm of your specialty, or in some cases they are random. I don't want to make it sound like that every prepayment audit is based on data that looks suspicious. Some of them are just random, particularly in the early stages. Those are becoming less and less, and now we're moving more towards the post-audits. However, to continue on the prepayment audits, CMS and Figliosi and Company will continue to conduct post-payment audits during the course of the EHR incentive program. Providers that are selected post-payment audits will be required to submit supporting documentation to validate their submitted attestation data. The audit process itself. The audit letter request will be sent electronically from Figliosi and Company and will include the audit contractor's contact information. The audit request letter will be sent to the email address that was provided during the registration process. There is a link to see a sample audit letter. However, we have also provided one for you. Basically, it will look something like this. You will see, as we indicated, both the CMS and the EHR incentive program logos. It will basically read something like, the Centers for Medicare and Medicaid Services, CMS, has contracted with Figliosi and Company, CPAs, PCL, to conduct meaningful use audits of certified electronic health record, EHR technology, as required in Section 1341 of the Health Information Technology for Economic and Clinical Health Act, HITECH Act, as included in Title 13, Division A, Health Information Technology, and in Title 4 of Division B, Medicare and Medicaid Health Information Technology of the American Recovery and Reinvestment Act of 2009. The HITECH Act provides the Secretary or any person or organization designated by the Secretary the right to audit and inspect any books and records of a person or organization receiving an incentive payment. This letter is to inform you that you have been selected by CMS for an audit of your meaningful use of certified EHR technology for the attestation period. Attached to this letter is an information request list. Be aware that this list may not be all-inclusive and that we may request additional information necessary to complete the audit. As is with typical government, this is pretty scary stuff, and it's pretty invasive in sounding and scary from my perspective. The initial review process will be conducted at the audit contractor's location using the information provided based on the initial request letter. This means that they are not going to come into your office initially. Now, they always have the right to do that. However, based on our history, this is what has happened normally. They will request the information, and you provide the information based. A secure process will be established to send the sensitive data. Given the nature of data that you're having, they will be sensitive, and they will give you a methodology to provide that. Once you submit the data, additional information may be requested after the initial review process. Occasionally, it may be necessary to conduct an on-site audit, which may include a demonstration of the certified EHR system. This has happened, and what this means is that if they come to your office and they request additional information, you will need to demonstrate and back up what you have provided within the EHR system. It's important to have a person intimately familiar with this in the event that this would ever happen in your practices. The states will have a separate audit process to conduct Medicaid audits, and to date, I am not familiar with anyone who has experienced a Medicaid audit. The process, I would imagine, is going to be very similar, and everything that we have researched on the surface appears that it will be. It will just be different entities conducting the audits. At the conclusion of the audit, the provider will receive an audit determination letter. The letter will communicate if the provider has successfully met the meaningful use requirements. And that's what we're all hoping for, and hopefully this presentation will help you towards that process. If the provider received EHR incentive payment prior to the audit and was found to be ineligible for an EHR incentive payment, the payment will need to be refunded. CMS may also pursue additional measures against providers who attest fraudulently to receive EHR incentive payments. The punishment may include imprisonment, severe fines. Providers may lose their license, exclusion from Medicare participation for a specified length of time. If I haven't made clear in this process, or any of you weren't thinking this is serious stuff, it is very serious, and it's critical that you be able to back up what you have attested for. If you were to be found in noncompliance of the audit, Medicare does provide for audit appeals. CMS has an appeals process for eligible providers. This must be done electronically and submitted to the email address that I have listed on this screen. The appeal submission process is time sensitive with a 30-day window for the submission period. The appeal will only be processed if all the documentation stated as a noncompliant is provided at the time of the submission. States have implemented an appeals process for Medicaid EHR incentive program, and providers should contact their state Medicaid agency for additional information. Every state that we looked at was slightly different, so you will need to, if you are testing under the Medicaid incentive program, you will want to check into this a bit further. So after listening to all of this scary stuff and wondering what we can do, we have some recommendations with practices that we have worked with and other groups that have gone through an audit. So we're going to take you through each of those processes now. First of all, create a checklist of all the required documentation. Print the documentation and put it in a binder. Also save the documentation electronically. Keep the documentation separated from year to year. Remember, the documentation needs to be kept for 6 years. And also remember, you must keep your documentation year by year for the different levels of attestation, stage 1, stage 2, stage 3 pending. Keep the documentation in a safe place. Don't have it somewhere that it can come up missing. That actually happened in one group that I worked with. They were able to locate it, but it was quite the panic. If you have it saved electronically, you can recreate, but you don't want to be doing that in a time-sensitive situation. Ensure that there are policies in place to transition in the documentation should an employee leave the practice or organization. If you think back to some of the slides we've looked at, there is a lot of information required, and the person who would be presenting in the case of an on-site office audit, or who would be presenting in a situation where they had to transmit this electronically, needs to have an intimate knowledge of not only your practice but the attestation. If the person who originally attested left, you would need to make sure that you have someone in place who can fulfill that obligation. I have a list of resources here, first for Figliosi and Company, Centers for Medicare and Medicaid Services, and then providers may also contact the EHR information system through a toll-free number. The EHR Information Center is open Monday through Friday, 9 a.m. to 5 o'clock p.m. Eastern Standard Time. I've also got links to the appeals documentation as well as educational resources that you can contact to find out more information specific to your group. The bottom line, this process does not have to be difficult. You just have to be organized. And if you need help organizing your data, conducting your security assessment, which is the most overlooked piece that I have found, validating your results, we have assisted a number of clients with all or any of these items and can help you if you want to move forward. And now we're ready for questions.
Great. Just a reminder, feel free to enter in any of your questions into the questions area of the GoToWebinar box. And looks like we have some coming in, Cindy. The Medicaid audits are much more in-depth and quite an ugly process to go through, just an FYI.
Yes, they are. I know of 2 of our clients who have, and both of them were successful. I don't know of any that were not, so I haven't heard of what, it's really, really scary when you think about what happens if you don't pass it. Hopefully you can cover it in an appeal, and no one wants to be in that position. However, it is a lengthy process, and typically I have known of 1 on site. So it's really important to be able to have this information and make it as easy as you can on if it happens to you.
Next question, will you be sending out this presentation?
Yes, I will. You can simply, I have the list of email addresses here. You can request from myself or Lloyd, and feel free to just send the email, and I will send the presentation out to anyone who would like a copy of it.
Great. Well, we're going to give you guys a couple more minutes here to type in questions. In the meantime, do you have anything else to add, Cindy?
I think the best thing to add is that having had this around for a while and meaningful use, and everyone was struggling to just make the measures and make what we needed to do, and wasn't a lot of thought given to what happens next. I think now is the time to just start focusing on how to move forward with it. What are your next steps? What happens if you don't meet it? Not getting into some of the next webinars, but we've got ICD-10 coming up. We've got, just general topics of meaningful use. The penalties are going to start hitting in 2015. What can I do to avoid penalties? All of these things. It's a very, very onerous process, and I think everybody on this call knows that, or they wouldn't be on the call. We've all struggled with it. It's been a challenging couple of years, and I don't see it going away. I think it's just a matter of being ready for it.
Cindy, what percentage of offices do you think will be audited?
That's a tough question because they're stating that it could be significant. Any of the research I've done right now of the offices I personally have worked with, I know of 2, and I know of 1 that's in the process of getting ready to go. If you think about how many offices we work with, I'm going to say on this particular topic that I would have heard, maybe 100. That's not a small number, talking about 3. It's not by any means 20%. I think as it moves forward and more people go, I think it's going to go up. I'm going to guess 20%. That's a number I've heard bantered around at MGMA and other things, although no one really knows. They have the right to audit any one of us at any time. I also think to kind of carry on to that the larger you are or the more exclusions you have, those type of things may trigger an audit. It's really going to be a selected population, I think. And honestly, it's just like the IRS. It's scary stuff. I'm scared to death that I'll ever have an IRS audit. I've never had one. Hopefully I never will. The facts are, if you're ready and you have your data to back you up, you really shouldn't worry about it other than just the fact that it's a stressful factor and nobody wants to take the time. I don't know that there's a lot you can do to avoid it.
Again, I want to mention that our next webinar is going to be on January 6th. ICD-10, it's back. So
All right. Well, thank you, everyone, very much for attending. I'm going to move through the slide back to just thank you, and hopefully you can join us for the future webinars. I hope you're finding these beneficial. If you have any questions that you think of after the conference, please feel free to email me. I'll be happy to find the answer or track it down to you. If you're interested in looking at some of the options that we have to help you, particularly with the security assessment, also feel free to reach out to me or Ann or Lloyd, and we look forward to seeing you in the new year. I hope you have a great and safe, happy holiday season.